The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.
Ontario has already lost almost 5,000 octogenarians and older during this pandemic. This week, as part of a cross-TVO collaboration, we're looking at stories of how we lived this year of COVID. And tonight, for the full hour, we're hearing from seniors and their families about what they've faced staring down the worst public health crisis in living memory. It's Tuesday, March 16th, and that's next on The Agenda. It's now 1 year less a day since Ontario declared the first state of emergency due to the COVID-19 pandemic. And through everything that's happened, the threat of this virus to seniors has been acute and top of mind for everyone. Policymakers, yes, but most of all for families and seniors themselves. With us to reflect on this most challenging year, we welcome in the provincial capital Devorah Greenspan, a long-term care resident, active on the leadership team of her Residents' Council, and treasurer of the Ontario Association of Residents' Councils. Devorah, it's really good to meet you. I want to start by asking you a bit of a tough question, because you no doubt have seen all of the coverage over the past year of what so many long-term care residents have been through, and I just wonder how you react to everything that's happened to you in this past year.
Everything that's happened to me has, it's kind of hard to react. There's so many things that happened to me and my fellow residents and all the residents in Ontario with this pandemic. It has been a horrific experience for all of us.
Well, let's start with this. Have you always felt safe where you are?
Yes, the home did a fantastic job of keeping us safe. One of the things I didn't worry about was getting COVID. I was grateful that I was alive and that my family did not have the virus.
Am I allowed to ask how old you are?
Yes, I'm 88.
88. Congratulations. You look terrific. How do you feel?
Thank you. Great.
Good. Glad to hear that. Again, a bit of an uncomfortable question for you here. Did anybody that you know at the residence where you live die of COVID-19?
Yes. Yes, some of my friends did. It's a very sad experience.
How did that affect everybody at the home?
Well, we were not able to contact each other. During the COVID outbreak, we were in our rooms and we were not allowed to go out. I was cohorted to another room because my unit was designated for the COVID virus. And because, thank goodness, I didn't have it, I was cohorted.
Right. Now, nobody wants to be confined to quarters. Nobody wants to be confined to quarters, but I guess you understood that that had to be done in order to keep everybody safe?
Yes, yes. Part of me was upset about being in isolation, but the other part of me realized that it was for my own good. However, being in isolation for me and my peers led to a lot of psycho and emotional problems as well.
Tell me about that, Devorah. What do you mean?
Well, people were upset. They were in isolation. We didn't have any human contact. When we were in COVID outbreak, the staff, who were very caring and compassionate, the frontline workers were terrific, but they had to wear the PPEs, which meant they were gowned. They had something on their heads, they had something on their feet. They had masks and shields, so we never saw a face. We just saw this person, and if you didn't recognize the voice, you didn't know who you were talking to.
Now, I presume at
And
some point,
I think
Devora,
that-
I presume at some point, you know, under normal circumstances, some of the people who work there might sit down with you, hold your hand, maybe give you a hug at an appropriate moment. I guess all of that was off over the past year. Is that right?
Yes, yes, totally. There was no human contact of any kind.
How tough's that been?
And you never saw a smile.
You never saw a smile.
Smile. And I think that was one of the hardest things, because I'm a people person, and the fact that I couldn't interact with any of my peers, and I didn't know what was going on, how they were doing, how they were feeling, really bothered me.
So what did you say to yourself to get through all of the lack of contact and the being confined to quarters and all of that of the past year? How'd you get through it?
I kept telling myself, if I give up, my kids are going to be very mad at me. I think thinking about my children and having contact with them over the phone and on Zoom. I was lucky enough to have a computer in my room when I was cohorted. I took my computer with me, and the fact that I could communicate kept me going, and their support. And thinking about them and thinking about the good memories, the fun we used to have. And I have their pictures on my wall. Like, I have pictures of my grandkids when they were little. And when I get down in the dumps or I get depressed, I look at the pictures and I think about all the fun we used to have. And that keeps me going, because I'll tell you, Steve, some mornings I don't want to get out of bed because there's nothing to do. And I can't stand boredom. I'm used to being active. Before all this broke out, I was taking courses at U of T and Brown University.
George Brown.
I remember the first. Thank you, George Brown. Mm-hmm. George Brown College. I was going there twice a week, and I was going to U of T once a week. So I was, and besides my ORC activities, I was constantly busy, which gave me a lot of purpose in my life. I loved doing that. And Saturdays I would get together with my daughter and we'd go out for lunch and sit and chat and have such a nice time. I really miss that.
Well, we look forward to the day when you can do all that stuff again. And Devora, I want to thank you for getting our discussion started here, but I also want to add that not all seniors, obviously, in the province of Ontario live in long-term care. So we want to add two more voices to our conversation here. We want to welcome two seniors who have toughed out this year at their respective homes in Guelph, Ontario. And with that, we welcome John Fessenden and Barb Anderson. John and Barb, it's good to have you along too. Now,
thank you.
Barb, why don't you start us off and tell us what the toughest part of the last 12 months has been like for you?
The toughest part for me, Steve, has been the reality that so many grandmothers have, in that I have not been able to hug my grandchildren and see them outside. So I would consider that to be the toughest part. I had to cancel a trip also out to BC to see my younger daughter, and that was tough. But boy, compared to Devora, my life has been quite bearable this year.
How many grandkids have you got?
Twins, Catherine and Elizabeth. I told them that I would mention their names who live in Toronto.
And I mean, presumably you've been allowed to see them outdoors or on the front porch or something like that at some point, yes?
We've had outdoor visits. And last summer, when things were relaxed a little bit, we actually were able to spend more time together.
But no hugging and kissing, I guess.
No. Lots of FaceTime.
Lots of FaceTime, yeah. A different kind of FaceTime, I get you. John, how about you? What's been the toughest part of the past 12 months for you?
Sort of two things. One is the fact that we can't be with our children, our grandchildren. My wife and I, our second marriage, both of our first partners passed away from cancer some years ago. Between us, we have 6 children and 10 grandchildren. And being apart from them, even though we can see them at a distance, is difficult. The other difficult part has been the inconsistency that we continue to hear with all the presentations of the politicians and the doctors, and trying to sort out what's really happening.
Okay, follow up on that if you would, John. Are you straight goods from everybody or what?
We're getting the straight goods the way they understand it. But the politicians are trying to be as friendly as they can, as positive as they can. Premier Ford, he's been out front, which is great. He tries to be positive. He also tries to follow the doctors, and they don't always merge. There's the same thing. So he'll be back and forth. The doctors, on the other hand, tend to be conservative. They tend to be forecasting poor results. And trying very hard to keep us all under control, shall we say? And those messages aren't always consistent with each other.
Right. John, do you know anybody who's died of COVID-19?
No, I don't. If you count my wife and I and our mutual children and grandchildren and their spouses, that's 22 people. Nobody has had any brushes at all with COVID. You can add in our siblings and their families, and now you're up to about 50, no one there. Our church, which we go to used to go to regularly, we're not aware of anybody there who has had it. And the building I live in, it's a condominium apartment building. There's about 130 people live here, and to my knowledge, nobody has had COVID.
That's quite amazing. Barb, how about you? Do you know anybody who's succumbed to COVID-19?
I don't personally, again, amongst my family, friends, no. I lived with my father in a retirement residence for 3 years at the end of his life, and I do see obituaries of people that I knew there that have died of COVID, but I don't have a real close relationship with them, but yes, there haven't been a lot of cases in Guelph.
Okay, I'm glad to hear that. Devora, let me invite you back into the conversation here, and I want to ask you again a bit of a tricky question. Have you felt at any point during the past 12 months that either politicians or family members or people who work at the long-term care home or others that you have encountered, do you ever feel like they're infantilizing you, treating you like a baby as opposed to the mature, capable 88-year-old person who was taking courses at 2 post-secondary institutions, how someone like that would want to be treated?
Well, if I'm talked down to, or I'm called dearie, I see red. And I have been called my dear, which annoys me. And I do tell the people, please, I have a name. I don't want to be called my dear. My name is Devora. Please call me by my name. So yeah, I guess that way I've been treated like an infant. But other than that, no.
And it doesn't sound like you like it when they try that.
No, I don't. I don't like being talked down.
Right. Barb, how about for you?
I feel the same way as Devora. I do not like being called dear. In a more gentle way. Well, first of all, I do find that seniors are treated as a homogenous group, that we're all the same. And I resent that we're not. also at the beginning of the pandemic, I found that my relationship with my daughters changed a little bit, whereas we'd all been three independent females who treated each other with a lot of respect and respect for our independence. Once COVID hit, they suddenly took on a very parental role. And I know it came from love and concern, but they were telling me what I couldn't do. And I resented that a little bit too. But I think we've come to terms on that. And over that, I did write them a letter about what my wishes would be in case I got COVID. And I think that cleared the air a little bit. So yeah, I agree with Deborah. We are treated sometimes as if we are infants or, yeah, no.
Well, I don't want to infantilize you with this follow-up question, but taking the kid's point of view for just a second, am I allowed to say how old you are, Barb?
I'm 76.
Okay, 76-year-old. So you're part of the demographic in which 99% of the COVID-19 deaths have taken place. So can I infer from that you understand why your kids were so very concerned about you?
Oh, of course I do. Of course I do. But it was just a shift in relationship that I noticed. Oh, I know, Steve. They're your age. they care about you, of course.
You got that right. I'm sorry. I'm trying not to infantilize my octogenarian parents, but I must confess, when you look at the math and the demographics, it can't help but cross your mind, right? John, how about let's get you on that. John, can we say how old you are?
I am just short of 81.
Just short of 81, okay. And have you found moments during this past 12 months where you felt infantilized by others?
No, not at all. The closest it came to it, last winter, we were down in Florida for what was intended to be 6 weeks. In the middle of the 5th week, the pandemic hit, the borders were closed, and I was called by one of my children and said, "Dad, get home now." We waited till the weekend, and then we did come home a week early. Other than that, about the only thing is periodically somebody on television will talk about the invalids or the frail people over 80. We're not all frail.
No, you sure aren't. I can see that just in this television picture alone. I can see you're definitely not frail. Barb, were you working for part of the pandemic?
I was. I retired in 2014, and then I went back to work part-time 2 years ago. And I was working for a small community service organization here. So I was at the beginning of the pandemic, I was working and continued to work.
But you've stopped since, I guess.
And then in August, I decided that because of the pandemic, I think life was too short. There were a lot of too short to do things that I didn't really want to do. And there were many things that I was looking forward to doing by being at home every day. Yeah, and I've done that.
Gotcha. Let me find out from the three of you whether or not you've had what everybody refers to as the jab in the arm. Devorah, have you had a vaccine yet?
Yes, I have. I've had both shots.
Okay, the next question I have to ask is, did it hurt?
No, not really. I didn't even feel the second shot. The first shot, I had just a small reaction. My arm swelled a little bit, but that was just for a day, and then I was fine. So basically, I didn't really have a bad reaction.
And what has getting the vaccine done to your confidence level or your comfort level being around nowadays?
Well, it means I feel like I can see my kids because I now have the shot, and my daughter and son-in-law are getting the shot on Wednesday. So I was hoping we could see each other, but it's not going to happen. We're still watching. We're still very cautious, and I'm still in part quarantine. I could go out into the hall in my unit, but I can't leave the unit.
And are they allowed to come inside and see you?
No,
They can't do that yet.
no, no. And I can't go anywhere either. The only place without going into 14-day quarantine. And,
Interesting.
It's not worth it.
Okay. John, how about you? Have you had your vaccine yet?
I had the first shot of Pfizer 3 weeks ago. Was given a date for the second one, which has subsequently been canceled, and I now have a new date in mid-June.
Mid-June. Okay, that's longer than you wanted to wait, I bet.
It's about 3.5 months, which is within the reality, within the criteria.
Okay. Did the shot hurt?
No.
Any adverse reaction after the fact?
The next day, a little bit of bruising on my shoulder, which went away literally within hours.
Okay.
So nothing serious.
Good. Barb, how about you?
I have an appointment this Thursday to get my first shot.
Ah, okay. You looking forward to it?
I am. Yes.
I keep asking people about whether or not the shot hurt or whether you've had an adverse effect because, as you know, there are all kinds of wacky conspiracy theories out there having to deal with all sorts of nutty ideas. And I'd like to just get some empirically provable evidence on the record because every single person I've asked about this shot says the needle didn't hurt. And if there was some difficulty dealing with it, it was very short-lived, and I'm happy to have the shot now. So I feel it's important to put that on the record. Tell me, John, whether or not your life has changed at all, maybe in the confidence with which you live, now that you've had that first shot.
There's sort of two parts to that. In terms of the actual activity, no change whatsoever. And I don't anticipate there will be for some time. But interestingly and unexpectedly, the day after I had the shot, I felt wonderful. I felt protected. I felt as if something had changed. And it's sort of worn off now, but it was a surprise and a nice thing. I have a cousin who's 81 in Peel, and she got her shot a week ago. And she texted me and said, I feel wonderful right after. I said, I know just what you mean.
Good for you. Devora, let me ask you this. You have really told us about how restricted your life is, even though you've had the shots. And I wonder whether you think all of those restrictions against visitors coming in or against you going out, whether you think they're acceptable.
I guess if visitors have the shot, I don't see why they can't come in. If we've all been immunized, why can't we not see each other? And why, if everyone in the home here has been immunized or vaccinated or got the shot, whatever you want to call it, why can't I go to other units in the home and mingle with my peers and see how they're doing?
Have you asked them about that?
Yes, and I get, well, we have to follow the government directives.
Okay. In which case, Barb, do you think that all over Ontario, right? We've had all sorts of restrictions over the past year. Do you think in the main those restrictions have been acceptable?
I do, Steve. In fact, I think that having the up and down, being restricted and then opening up and restricted and opening up has been confusing. And part of me wishes we could have just had could have a short, sharp, close everything down and get the numbers down. But then it doesn't affect me. I'm not a restaurant owner or owner of a small business as much as it does others. But to me, that would seem to be what should have happened.
Right. John, how about you? Do you think the restrictions have been justified?
On the whole, yes, although I do feel that the medical people are trying to err on the careful side. Let me give you a specific example. We're in the Wellington-Dufferin Guelph area, and each day, 5 days a week, they publish a series of results. And they have 8 particular things, and they grade them the same way the province does theirs. Last week, we had 4 greens, 2 yellows, and 2 oranges. So where should we be as a unit? Red, of course. Not so sure. However, as I say, they're trying to be careful. They're going to protect us from COVID regardless of what the consequences are.
I hear you.
And that's what they're trying to do.
Devora, I'm going to finish up on you because you've got this kind of very official title that you're not only part of the Residents' Council, but you're the treasurer of the Ontario Association of Residents' Councils. So in some respects, you're going to speak for the whole province of Ontario here when I ask you, if you wanted to say something to Marilee Fullerton, the Minister for Long-Term Care, what would you tell her?
The pandemic has brought out the fact that long-term care needs a lot of fixing. I would like to see something started and not just get lip service.
What's one thing you'd like to see better?
I'd like to see more staff and better paid staff, so that being in the healthcare sector would be appealing to people. Before the pandemic, these poor girls who worked so hard had to hold 2 jobs to make a living. That shouldn't be. They should get enough money so they could live like the rest of us and not have to run to 2 and 3 jobs, which they can't do now anyway. So I would ask Ms. Fullerton to consider putting more staff in all the long-term care homes to improve the quality of life of all seniors.
I can tell you that is a recommendation that she has heard from hundreds, if not thousands of people. But good for you for passing it along as well. Devora Greenspan, Barb Anderson, John Fessenden, it's really good of all of you to join us on TVO tonight. Stay safe, and hopefully we'll be able to hoist a glass of some soft drink somewhere down the road.
I hope so too.
Okay, Steve.
Thank you.
It was a pleasure speaking with you.
Pleasure was all ours.
Yes, it was, Devora.
Thank you. Thank you very much.
Coming up Thursday on the agenda.
To that point about whether the East versus the West did better, or whether, you know, it's individual versus collective, I think there's another fault line all across the board that this pandemic has shown. It's the embrace of globalism versus perhaps national self-sufficiency, if we'll call it that, or nationalism or protectionism.
That's Thursday on the agenda. Well, it's been just a terrible year for residents of long-term care in this province, and that's been true for their families as well. On the outside, looking in, quite literally, at parents, grandparents, spouses, and other loved ones in those facilities. With us now for a look at some of the struggles they faced and what it's been like to deal with the distance and loss. We welcome, in Thunder Bay, Ontario, Sherry Koch, who spent more than 8 years as an essential family caregiver. In the nation's capital, Julian Morelli, patient and family advisor for the Ottawa Hospital and a member of Ontario's Pandemic Recovery and Planning Working Table. And in Oakville, Ontario, Crystal Nikolic, Family Council Chair at the Post-Inn Village Long-Term Care Home. Good to have you three on this program. Sherry, maybe you can start us off here. I want to know more about what it means to be, quote unquote, an essential family caregiver and what that has meant for you over the past year. Start us off there if you would.
Well, I can tell you the first 6 months was very long, 6 months waiting and wondering when we'd ever be able to get back in. So when we were able to last summer hear this word of essential caregiver, it was exciting and thrilling to think we might be able to get back in. And so in our case, we were able to get back in late August of last year, which was 6 months. And it was just so, I can't tell you the feeling of being able to go back in and hug my dad for the first time. It was wonderful.
Can you tell us a little bit more about that moment, going that long a period of time without being able to hug or kiss a family member, particularly a parent? Must have been just gruesome. So how did that moment go?
It was a bit odd because, of course, the staff there, you know, they're seeing family members come in for the first time, and it was all a little bit. Everyone was a bit trepidatious, not wanting to get too close to one another. The staff were excited to see us as well, but it was really, really exciting for me to go in. It was very, very emotional. But very good on the same hand that we were going to be able to go in more regularly and get on a schedule again and see them, even though they might not remember us. It was still good for them to have somebody besides the staff have their eyes and ears on them.
Right. Julian, let me bring you in right now, and as I do so, I'm going to ask our director Sheldon Osmond to bring up a picture, and I'd like you to tell us who the three people are in that picture.
Well, in the middle is my bonus mom. I call her my bonus mom. That's Mary Lou Kennedy, and my lovely wife Heather on the right, I guess, and I think me on the other side. And we were celebrating her 92nd birthday at her my brother-in-law's home, and that was last year. That was last year, 2020 in March, actually.
Now you call her your bonus mom, but she's your mother-in-law, right?
Yeah, I call her my bonus mom. I call her my second mom. I like the term bonus mom. I have a bonus daughter too, so I call her. She's really that special to me.
And what was important about that moment that you got on camera there?
Well, it was her birthday, and we were celebrating. We were just about to leave, and I don't know. It was just a shot that happened, and we had had a great evening. It was just before the pandemic happened. It was just before the lockdown came into effect, of maybe a day or two. And we had brought Mary Lou over and celebrated her birthday together with her family, and everybody was there, and had a great time. And she was fluent, lovely, fun. I did a bunch of video as well. Great. Yeah.
Crystal, tell us the significance of the past year for you in terms of this story we're covering tonight.
Well, this story tonight has a huge significance for me because my mother's on a secure unit. And during the pandemic, a secure unit's where you lock up the people that are shoppers or walkers. It's a small prison in long-term care, basically. I know people don't like us to use those words, but what I watched happen to my mother on the secure unit over years, and what we watched through the pandemic, was deterioration. And it was horrible to stand outside there in the window. I could stand outside and see my mother inside, and I could see the deterioration of the other residents. So it was very, very, very difficult. And for me, the pandemic has been about advocating for the rights of family caregivers and all the other residents in the home, because we have 238 residents in our home, 4 floors. What I could see on the small little 17-person secure unit, we knew was happening throughout the home. So it was very tragic for me. And
we'll explore those issues more that you've just raised there. But I do want, Sheldon, I'm going to ask you the same thing here. Got a couple of pictures to bring up. And again, maybe Crystal, take us through these 2 pictures. Who are we looking at?
We're looking at my mom, 6 feet across at a table when visiting first started. So you can't touch her, you can't hold her, you can't walk with her. You see it's a fairly nice day outside. This is about June, I think, during when we first were able to have outdoor visits. This is my mom on FaceTime. So she has dementia. She doesn't understand FaceTime. Actually, there were some funny shots of I'd be trying to talk to her and she'd think FaceTime was a mirror. You know, I mean, with dementia, they don't understand these different types of ways that we were visiting with them, so to speak, or providing emotional connection. I don't like the word visit because we provide a lot more as family caregivers.
Right. So given her dementia and given this technology that you say she didn't understand, could you make a connection with her under those circumstances?
Not really. I mean, I would wave at the window and stuff. Now, I have a phone in my mom's room, so I implemented phoning her every morning and having my brother speak to her every evening. Anything we could do so she could hear our voices. My brother lives down in the States, so, you know, he couldn't come up to help or anything. So it was pretty tragic.
Well, we have heard estimates that the amount of money or the value to the economy, let's put it that way, of caregiving can amount to $25 billion a year in Canada. In other words, all of the work that you all did out of the goodness of your heart, if you add it all up across the country to all the people like you who are doing essential caregiving work. If you had to pay for it, it would amount to $25 billion a year. Let's get a better sense, and Sherry, maybe you could start us off here. How many hours a week do you think you spent caregiving in your circumstances?
Well, for myself, I was probably there 3 to 4 times a week for hours. But in our situation, I'm the only family member in Thunder Bay. So we also hired extra staff to go in, and we also were lucky to have some family friends. So there was somebody with my parents every single day leading up to like before the pandemic. And I can tell you that as essential family caregivers, we know things about our family that even PSWs that are there every day don't know. So, you know, a grimace on a face, or the fact that they're not quite eating, or they're scratching some area of their body, or whatever it might be, we know them better than any staff member does. So we can pick up on things that staff don't pick up on.
Julian, how about you? How many hours a week would you say you and your wife attended to your, as you like to call her, bonus mom?
Yeah. Well, at minimum, Steve, it was 50 hours a week. I call it direct care. I call it essential care, and it's way beyond visiting. It's way beyond we're just hugging. Actually, the term essential family caregivers, you know, I started using a couple of years ago, actually, way back, and I'm glad it's catching on, because families are essential. But we were spending minimum of 50 hours a week. My wife, for instance, would spot an infection. I learned more as I kept going, and I could spot that something was wrong. And I would say, well, we should get her tested for a UTI. Those infections are deadly if not treated properly. And I would say quite candidly, my wife alone has saved her mom's life.
Julian, 50 hours a week is more than a full-time job. Did it feel like that?
Well, yeah, but I called it a labor of love, honestly, and I don't say that just to come up with a nice tagline. It's probably it's not. It is the hardest job I ever had, but the most satisfying and actually a privilege. But add on to that, Steve, that didn't take into account the interactions we had with government, with the institution, with doctors. So you can easily add another 10 hours. And going back to your comment that of 25 billion, that 25 billion is an absolute minimum figure. There's credible numbers that bring it up to 60 billion. And it brings it up there because in the sense of care, if we prevent my mother-in-law from going into a hospital, how much money do we save?
Right.
And we have done that. And that's just the start of it. And so I'm going to preface it by saying we're more than visitors, and actually caregivers are experts who come from every walk of life. Doctors, lawyers, architects, you name them, they're in the business of caregiving.
Crystal, how about you? An estimate at how many hours you've spent?
I spend a ridiculous amount of hours. I'd say I work at 7 days a week, 12 hours a day. And that's not just with my mother. That's the advocacy work I'm trying to do to help family caregivers speak up wherever we can, whether it's in research forums, at Family Council, virtual forums. Family Council Ontario has many, many, many different areas that people can go, talking to experts, not just ourselves, the other family caregivers. We are the experts, but talking to the people who are leading policy and leading changes, and making sure that our voices are at the table. I think that's the most important thing, that the voice of family caregivers are now part of policy, planning, procedures, implementation, programming. We have to be there. We're the consumers. We pay the bill. Our family members, I mean, my mom, you know, paid her taxes all her life. I pay her for $2,700 a month for her care in a home. That's what the Ontario government for a private room charges. So we spend a lot of time, money, and yeah. So we deserve a little bit better than just sitting around and being left out all the time.
I hear you. Sherry, I alluded to the fact earlier in our conversation that this is the first anniversary of the state of emergency being imposed. It's also a sad first anniversary for you this week as well. Want to tell us about that?
Yeah, my mom passed away on March 20th of 2020. And, it was no surprise to me that when we were shut out of the home on the 13th of March, that the very next day my mom stopped eating. As I mentioned earlier, we were in the home every day, somebody was, and we were able to, she was at late stage dementia and definitely wasn't eating as often anymore. But the people that knew her well knew to stroke her hand, touch her face to get her to eat. And as soon as we were shut out of the home, the care staff just don't have the hours that we did to spend with her. And so it was no surprise that she stopped eating a couple of days after we were shut out, and of course, passed away a few days later, so on March 20th.
And we just saw a picture of your parents, and I gather you were also caregiver to your dad at this time as well?
Yes, my parents lived across the hall from one another, finally, for the last 3 years in our long-term care home. And, my dad actually contracted COVID-19 in that home and passed away on December 9th. So we've had a lot of loss this year, our family.
My goodness. Sherry, how have you coped with it all?
It's been a challenge through COVID, obviously. Funerals aren't the same, gatherings aren't the same. Luckily, I have a great family, wonderful husband, 3 great kids, and lots of wonderful, wonderful friends. And so, we've coped with it that way. But it definitely has, 2020 will always be a memorable year for not great reasons, obviously. For sure, COVID, but the loss of actually 3 parents. We also lost my mother-in-law in July. So it has been a very challenging year for our family.
I was just going to say, I heard your mother-in-law had a stroke as well, and she passed away from that too. So my goodness, You've had enough of 2020, that's for sure, eh?
Yeah, it definitely was. We definitely celebrated on January 1st, that's for sure. My mother-in-law was a different case too. In the hospital, 1 month full, on her own, we couldn't go in, and she had a stroke. So it's definitely, COVID has added layers to grieving. It's added layers to caring for. It's certainly been challenging, yes.
I want to take you back to a happier date. This is almost a quarter of a century ago. Sheldon, you want to bring this picture up, please?
Oh, goodness.
And why don't you tell us, Sherry, who's in this picture? That's a beautiful shot. That's just a beautiful shot.
Oh, well, thank you for sharing that one. I just shared a few pictures with you. That's my wedding day, and that was my dad. And he had a great sense of humor, and he was definitely making me laugh as we entered the church. Yeah.
And then we're going to do fast forward to November of 2020, and
that is the day we had a really tough weekend the weekend before. Our long-term care home did not handle their outbreak well at all. And so we had come off a horrible weekend. My dad had tested negative so far. And this is November the 23rd, that picture. And I had gone home after spending time with him that day and was called that evening to let me know that my dad had COVID-19. So he had tested positive. So I was shut out of the home for 2 weeks because, of course, I had been in close contact, and I had to quarantine myself in my room for 2 weeks, not able to go back in and see him. So that is a memory of a last time that I was able to care for him when he was well.
Were you able, you had 3 parents, if you like, that you were mourning. Were you able to have any funerals?
My mother-in-law, we had some eased restrictions by July, and I think we were allowed to have 40 people in a church. So we were able to have a funeral for her. But for my mom, it was very early in the pandemic. We were only allowed to have 5 people in a funeral home, and my immediate family is 5. So we wouldn't have even been able to have a minister. My brother lives in Ottawa. And then my dad was in December, and in Thunder Bay, our numbers were going quite high in December. So for both parents, we did actually a YouTube tribute to them that I was totally against, but we were able to have almost 500 people watch both YouTube videos. Wonderful tribute to both parents, people being able to watch it from all over Canada and United States, friends of theirs that wouldn't have been able to come otherwise. So it ended up being wonderful, but it definitely was, can you imagine having a YouTube funeral? I mean, it just really wasn't what we had ever envisioned for them. And still not being able to gather and be with people to this day, to honor our parents.
Sherry, thanks for sharing those pictures and those memories with us. We're really grateful for that. I know it's been a miserable year for you.
Thank you.
Julian, I want you to pick up the story if you would, and that is, I mean, we have you three on tonight. The fact of the matter is, there are thousands of people across the province of Ontario who could tell similar stories to what we're hearing from you three tonight. Lots of people are going through this. Can you describe for us what you think the emotional toll all this takes on caregivers across the province?
Well, it's 24/7. It's horrendous. I mean, the emotional toll it takes on just a relationship with your family, and it starts there, and there's different thoughts about how things should be done, and it's like all consuming. It literally takes over your life, and as you said, Steve, it really, we're just one. I mean, this is happening to thousands and thousands and thousands of people. This is not, 1,000 people, it's thousands. And it's consuming PTSD. I think I said in my testimony to the commission that I think it's probable that we have it. Wake up. My wife has issues now with her teeth, great teeth. She's been chewing them. I wake up at 3 a.m. every morning. I have vivid dreams, which I never had before in my life. I've never done that, and it is horrendous because it's 24/7, which means in your sleep, it's happening as you're thinking about what's tomorrow. What about the doctor? How is she being treated? We're not there. And as Sherry said, when I'm listening to her, I mean, I just was thinking, holy, like it's a world that only caregivers right now know. They really understand it. They don't even have to talk about it. And yet people, like our families included, and others, I don't blame them. How much can you talk about this stuff? They don't want to hear it after a while. And I don't blame them. I don't want to be talking about it. In fact, I've gotten closer to caregivers because they get it. And that's not a slight on anybody, but people want to go out and barbecue. I get that. So do I. But I can't go to a function and say, or something right now and say, oh, I'm just looking forward to the summertime. That's not in my headspace. And to pick up again on Sherry, like 3 immediate family members, I don't know what to say. I mean, other than I take a second just to memorialize your family and you and the strength you have. That's what I can say, and that's the strength of caregivers.
Crystal, how do you get away from it? I mean, every caregiver needs a mental health break at some point. How do you do that?
I think that's very difficult to do. One of the things that I try to do is a little bit of exercise. I think I passed the point where personal care happens anymore for me, and getting a break happens anymore for me. One thing we do have is a writer's workshop that we do once a week where we talk about our issues. That helps a lot. I can't get away from it. I can't.
You live it 24/7.
Yeah, I live it 24/7, like the other people are saying. I think the long-term damage it will do on caregivers will be that will be coming in the future. I think there will be physical and mental deterioration of us. I think that's happening now at this point.
Well, let me follow up with Julian on that, because Julian, in your last answer, you did point out that you made a submission to the Long-Term Care Commission that the Ontario government has struck, and which is supposed to report in fairly short order, I think sometime in the next 6 weeks or so. Did you actually get to make the presentation, or did you just give them a document, and how did that go?
No, I made the presentation, and for caregivers, it was a bit different. They did it anonymously, so I would have preferred that it was out there. But caregivers, many of them, were afraid of retaliation, and that's not an if, that's a fact. And so the commissioners themselves made our testimony. We did it online.
Retaliation from whom?
Anonymous. And pardon me?
Retaliation from whom?
Well, I mean, if you're in the press and you said something that somebody would perceive negative, it could be from the home. It could be from someone. We had to be very careful. Like we knew that this wasn't the home's fault. For the most part, our home. They were trying, they were working, but there was times that we had to talk about specific care issues. So we had to be very careful. And people that went in the press, it's well known within the care thing is be careful what you say. And so for the commission to make caregivers anonymous says it all. And yet I chose my testimony, I'm going to release it because I think it's important that people know that the reality is in the business that of healthcare and a democracy that we should be able to talk. Nobody's trying to become political. I'm not. I mean, that was my business before. But the dignity of our parents and your parents and everyone's parents, your sisters, your brothers, is at stake. It's a Canada health system. We have a democracy. And the fact that we had to, the commissioners felt it was in the best interest of caregivers to make it anonymous, and if they chose to put it out there, fine. This speaks to a lot of issues, speaks to a lot of discrepancies and errors, and I'll just call it flagrant denial that this stuff was occurring. So it needs to be out front.
Well, let's get some more on the record here. Sherry, if you had a chance to make a submission to the Long-Term Care Task Force or speak directly to Marilee Fullerton, the Minister of Long-Term Care, what would you tell her needs to be done?
Well, it's so funny that you say that because prior to the pandemic, I had gone on a personal crusade to write to her. I was writing her personal invitations, pretty colored envelopes, inviting her for lunch to come to Thunder Bay to have lunch with my parents and I, so they could actually, she could actually see the staff ratios that just don't make sense. And actually, I finally got a response from her in January of 2020, but we know what happened after that. So I've never actually been able to speak to her. But we need a comprehensive staffing strategy. The unregulated workforce, the PSWs, they need to have more attractive jobs. They need to have full-time jobs. They need to be paid better. And when we also need more registered staff. But the staff ratios also are ridiculous. And we have to start really looking at that. And we have to start making it regulated, government regulations of staff ratios that cannot be interpreted at the home level. They actually have to be followed. My dad's floor was 1 to 22. So one staff, to 11 residents. And they needed to have 2 people working in tandem because these are adults that are 200 pounds, 130 pounds, whatever, that might be combative. So they needed to have 2 people in a room with each resident. So when the 2 staff people are in one room, there's nobody on the floor watching anybody else. So the ratios are ridiculous. And these poor frontline workers who work so hard are really being thrown to the wolves right now. And we need to change things for them. We need to make their work life more attractive. So the 2 things that I would say to her, if she would love to come for lunch with me, is a comprehensive staffing strategy and better staff ratios that make more sense.
If you ever do get to take her out to lunch, will you let us know so we can eavesdrop?
Oh, I would love for her to come to lunch. I don't have parents anymore to have lunch with, unfortunately, because of what happened this year, but I would certainly love for her to come and actually see with a family caregiver, not just go into a long-term care home, because of course they're going to be on their best behavior when Dr. Marilee Fullerton walks in. I wanted her to come to lunch with me so I could show her what the real staff ratios are and how ridiculous they are for anyone to try and manage.
Well, Sherry, Julian, and Crystal, we are really supremely grateful that the three of you opened up so much and were so candid about what the past year has been like for you and your families. And we're grateful that you spent so much time with us here on TVO tonight. I hope 2021 is just way better for all of you and yours. Thank you so much.
I agree. Thank you so much.
Thank you.
And that is the agenda for Tuesday, March the 16th, 2021. Tonight, right after this program, you'll want to stay tuned for the premiere of the TVO original documentary, Dispatches from a Field Hospital. It tells the stories of several families as long-term care residents were moved to a field hospital in Windsor, Ontario during the first wave. It's part of our cross-TVO collaboration this week, looking at how we've lived this year of COVID. You can find agenda conversations, new documentaries, and articles from across the province at this website, tvo.org/COVID Inside Stories, tvo.org/COVID Inside Stories. And join us again tomorrow on the one-year anniversary of Ontario's first state of emergency declaration during this pandemic for a look at the geography of how the virus came across our borders and spread across Canada. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.